Good day, everyone. So for today, we're going to talk about the infectious diseases of the digestive system. The digestive system is vulnerable to a variety of infectious diseases caused by bacteria, viruses, parasites, and fungi. This report we're going to focus about the comprehensive overview of infectious diseases that affect the digestive system, shedding light on their impact on human health and the importance of timely diagnosis and appropriate treatment. Through this presentation, we aim to provide valuable insights into recognizing and managing infectious diseases on the digestive system effectively. Now, we are going to talk about the 4 bacterial diseases, 3 viral diseases, 2 fungal diseases, and 1 protozoal disease found in the digestive system. The 4 bacterial infections are the Salmonellosis, Helicobacter pylori infection, Clostridium difficile infection, and Escherichia coli infection. Salmonellosis is caused by the Salmonella bacteria and typically presents in gastrointestinal symptoms such as diarrhea, vomiting, and abdominal cramps. Signs and symptoms include diarrhea, vomiting, and abdominal cramps. These bacteria are commonly found in contaminated food, especially raw poultry, eggs, and unpasteurized milk. This also occurs in person-to-person transmission. Antibiotics are used to treat severe cases of salmonellosis. Commonly prescribed antibiotics include ciprofloxacin, azithromycin, and ceftriaxone. The second is Helicobacter pylori is a bacterium that infects the stomach lining, leading to the peptic ulcers and gastritis. It can cause chronic inflammation and damage to the stomach lining. Signs and symptoms include abdominal pain, bloating, nausea, vomiting, and intended weight loss. Some individuals may remain asymptomatic. This kind of bacteria transmitted through contaminated food or water and person-to-person contact. It thrives in the acidic environment of the stomach. Treatment of this infection involves a combination of antibiotics such as clarithromycin, amoxicillin, and metronidazole, along with acid-suppressing medication. The third one is Clostridium difficile infection, or the CDI, caused by inflammation of the colon, leading to the severe diarrhea and colitis. In severe cases, it can result in life-threatening complications. Signs and symptoms of CDI include watery diarrhea, fever, abdominal pain, loss of appetite, and dehydration. The infection can be challenging to treat. CDI is commonly acquired in healthcare setting through the fecal-oral route, especially after antibiotic therapy disrupts the guts of microbiota. CDI treatment involves antibiotics such as vancomycin or fidaxomicin to target the Clostridium difficile bacteria, along with probiotics to restore gut flora balance. And the last one is Escherichia coli infections can lead to diarrheal illnesses with symptoms including abdominal cramps, bloody stool, and dehydration. Signs and symptoms of this bacteria is diarrhea containing blood, severe abdominal pain, vomiting, and sometimes fever. This bacteria occurs through the consumption of contaminated food or water, direct contact with infected individuals, or exposures to animal feces.
Next is viral diseases in the digestive system. There are 3 viral diseases in the digestive system. First is hepatitis A. Hepatitis A is a liver infection caused by the hepatitis A virus, HAV. HAV is spread through contaminated food or water or close contact with an infected person. The signs and symptoms of hepatitis A are jaundice, yellowing of the skin and eyes, fatigue, nausea, vomiting, abdominal pain, and loss of appetite. Mode of transmission: fecal to oral route, often through contaminated food or water. So, ang hepatitis A virus is transmitted primarily by the fecal to oral route. Maghambal kita fecal to oral route, it means when an uninfected person nag-ingest ng food or water that has been contaminated with the feces of an infected person. So, wala pa siya specific nga bulong para sa viral disease nga hepatitis A, pero may ara siya treatment like rest, adequate nutrition, and fluids para sa essential nga recovery. The second one is norovirus infection. Norovirus is a highly contagious virus that causes vomiting, diarrhea, stomach cramps, and fever. The signs and symptoms of norovirus infection are diarrhea, vomiting, nausea, stomach pain, fever, and headache. The mode of transmission sang norovirus infection are fecal to oral route, direct contact with an infected person, or consuming contaminated food or water. So, wala pa specific nga antiviral medication for norovirus infection, but may ara mga treatment para sa recovery ga-involve di ang supportive care such as hydration and rest. The third one is rotavirus infection. Rotavirus is a virus that causes diarrhea, vomiting, and fever in young children. The signs and symptoms of rotavirus infection are severe diarrhea, vomiting, fever, and abdominal pain, often affecting infants and young children. Mode of transmission: fecal to oral route, person-to-person contact, contaminated surfaces. Drug of choice: rotavirus vaccines are available for prevention. Treatment focuses on managing symptoms such as dehydration with oral rehydration solutions.
Two fungal diseases in digestive system. First is Candida overgrowth and then invasive aspergillosis. Let's move from Candida overgrowth. Candida albicans, a type of yeast normally present in the gut in small amount. Next here is sign of symptoms, mode from transmission, and drug of choice. Let's start first in sign of symptoms. Digestive problems such as diarrhea, constipation, bloating, gas, and nausea, and vomiting, mouth thrush, white patch on the tongue and inner cheeks. Fatigue. Next is mode of transition. Overuse of antibiotics weaken immune system, certain and medical condition. And drug of choice: fluconazole or diflucan, intraconazole, or sporanox, clotrimazole, or lotrimine. Let's move from invasive aspergillosis. This cause is Aspergillosis formigatus. A mold invasive aspergillosis occurs when the fungus invades the tissue of the body, such as the lungs, sinuses, or brain. Next here is sign of symptoms, modes of transmission, and also the drug of choice. First, in sign of symptoms, abdominal pain, nausea, vomiting, diarrhea, and next is inhalation of mold spores, direct contact with a contaminated surface. Drug of choice is isavuconazole, gasfologin, and mecafogin.
One protozoal disease in the digestive system named amoebiasis. Amoebiasis caused by the parasites Entomopia histolaica. Amoebiasis can present with a range of symptoms including mild diarrhea to severe dysentery with blood in the stool. In severe cases, it can lead to liver abscesses. These are the signs and symptoms of this kind of disease: abdominal pain, bloody diarrhea, fatigue, weight loss, fever, and liver abscesses. Amoebiasis is primarily spread through the ingestion of contaminated food or water containing disease form of the parasite. This disease can be treated through the use of antibiotics like metronidazole and paramomycin. That's all, and I hope you have learned something. Thank you.